Laurie, hi.
Hey, how's it going, Peter?
I am so glad to see you here today. When I was preparing, I was thinking, oh my goodness, I'm so excited to see Laurie again because I know that you'll have
Oh,
so much information for dog lovers around the world. And I always feel so grateful and privileged to get the time with you. And I know you're busy. You shared with me that the way you handle things and the reason why you're um, so good in sharing information and so prolific is that you actually don't really get much sleep. Is that right?
that is very true. That is very true. If I get 5 to 6 hours
uh,
at night, I'm like thrilled.
this is what happens to creators and people who are really who find joy in learning. Like there's not enough time in the day, right? And so this is what you do.
Mhm.
I understand that for sure. Did you know that there was research what makes people happy? And one of there were two things. I can't remember the second one, but one of them was the joy of learning,
Mhm.
and that makes us super happy. So
Absolutely.
today we'll be talking about the joy of learning, and we'll talk about laser therapy.
Mhm.
Before we start, I know that you've moved from general practice to launching the first veterinary rehabilitation clinic and designing an underwater treadmill and inspired many veterinarians and many dog lovers and just kind of looking into mobility and how we keep our dogs
Yeah.
strong because that is the most important part in the course of their life to enjoy life and also be living longer. So how did you move from the general practice to launching the first rehab center?
Oh, that's a story. If you want to hear the story. So I listened to my dreams, I listened to my heart, and I was in general practice and I was in what we called the Cadillac practice. So back in 1998, we had color flow Doppler, we had all certified technicians, we practiced really, really high quality medicine. And it came upon my heart that I had to learn acupuncture. And I went to my boss and I said, I want to learn acupuncture. And he said, I don't believe in it. I won't give you the time off. I won't pay for it. And if you do it, I won't refer to you. So it was very clearly a line in the sand. I needed to follow my heart. So started looking into acupuncture. And at the same time, my sister-in-law who trained police dogs said, listen, if you're doing acupuncture, can you look at like dog physical therapy?
Hmm.
Because we have all these police dogs and they get hurt and the surgeon says they're fine and the x-rays look good and they don't function the same. And I said, sure, I'll take another course. Well, needless to say, I left my Cadillac practice to start my own tiny little practice. And 6 months later, my old boss passed away, like heart attack. And everyone thought I was going to buy his practice. And if I had stayed there, I probably would have. And my whole life the whole world would have changed, right?
Hmm.
And
Hmm.
instead, I
Hmm.
started this tiny little practice. I had a brand new son who was 6 months old. I read every PT book. I did everything I possibly could to learn everything about physical therapy. I interviewed people. Like you said, I designed the first underwater treadmill. I took a human model and designed a concrete pool with glass. I got information from the Brookfield Zoo on their polar bear things, the enclosures, and we put in a security camera. And I had a monitor so that I could be in the treadmill watching the dog, watching their gait from the back, from the side, and thinking that I was going to work 3 days a week, 6 hours, 6 hours a day, so I could work with my son. And it just mushroomed. And within six
Hmm.
months,
Hmm.
I was looking to hire an assistant, and then it was another doctor. And then within 3, 4 years, we moved into a 4,000 square foot facility with 2 underwater treadmills. We had 4 full-time doctors. I was teaching at the rehab certification course. I was writing chapters on rehab for technician books for the first and second, well, a bunch of the rehab books. It was just a very much a God led, this is what you're going to do.
Uh-huh. Uh-huh.
And, sometimes I put my heels in and say, but I don't want to. Like teaching laser. Before I knew anything about laser, I had a dream that I was going to be teaching on laser. I'm like, I don't want to. I don't want to have to learn anything else. Bam, right? And then it happened and I got asked to speak and I'm like, oh my God, I have to learn as much as I can about it because I have to teach on it.
This is a form of veterinary enlightenment when I'm listening to you about the light and laser beams and so on. This is the enlightenment that we're talking about as well. And as
Mm-hmm.
you're talking, I'm thinking, oh my goodness, Laurie was inspired by nature and the universe
Mm-hmm.
because, when you look at in nature, my dog packs. loves to fish and walk in the water constantly. That's his passion. Every time he does that, I think of you because he basically made it available and possible for all the dogs that actually can't wade in the water somewhere nearby. Going back to you educating dog lovers and colleagues, veterinarians,
Yes.
you received significant accolades and awards and rewards for doing what you love to do. What motivates you to educate others in veterinary rehabilitation and using laser? And how has it influenced the approach to pet care in general, you think?
I think of my gifts in life, right? My God-given gifts are healing and teaching. And when I do those two things, my cup gets full.
Mm-hmm.
So not only do the dogs get better, I have great discussions with my clients. I teach them, whatever I can about anything I can. And then I always feel better afterwards.
So your cup is full and overflowing sometimes, right?
Absolutely. Absolutely. And it's my passion, right? It's, people say, when are you going to retire? Because, I'm getting a little older and I'm like, the day before I die. Otherwise, I'm giving up my favorite hobby.
I'm glad that you're not the only one who thinks that way because, colleagues and friends around me retire. I just turned 60 and people are asking, so when are you going to stop? When are you going to sell the company and sail off into the sunset? And I go, virtually exactly the same thing that you do. Like, why would I be retiring when I combine life and work together and it feels good, right?
Yeah. And I literally tell my clients, my goal is to empower them to help their pet. So you may laugh, but one of the things I say is, I really like you, but I want to help you so I don't have to see you that often. So you can help your pet and I can help somebody else. And they all laugh.
It is so funny. I feel like we came from the same universal pod or something because I usually say, my goal is to put myself out of business, right?
Yeah.
So speaking of light and enlightenment, and laser light and laser beams. I'm aware that even the ancient philosophers were talking about light and how healing and important it is. And then in the 60s, laser light was basically just kind of, hit the general market and it actually was discovered in the 60s. Is that right?
So light therapy has been around since Hippocrates' time, right? And I actually was just listening to a Peter Attia podcast. And he had Andrew Huberman on, and they had a great research article that talked about seeing the sun rise and the sunset and how it affects the back of your eyes and affects your brain and resets your circadian clock. And I'm like, oh my God, that's so important. And how being outside is so important for your health and your brain and your longevity. And I thought that was amazing. So yeah, there's that kind of light. In the 1960s, they looked at ruby lasers and then helium neon lasers, and they started using them for skin and all kinds of things. And then over time, they were able to get different substances in the lasers, right? So depending upon the substance, like ruby or helium neon, that's inside the laser, it has different wavelengths. And then those actually create different effects in the body. And then also the wavelengths and the power control how deep into the body.
So lasers are integral to technology and medicine. We know that. And I'd like to know, and if you could explain in simple terms for everyone who's listening and watching, what a laser beam is and how it's different from the regular light.
Absolutely. So in order to be, and this may be a little nerdy, and that's okay, I'm a nerd. I own that.
Let's be nerdy.
In order to be, in order to be a true laser, it has to be monochromic, which means one wavelength or one color, right? Chromic color. It has to be collimated and it has to be coherent. Right? So all of the beams, all of the photons have to move together. And that's what gives it the power to go into the tissue and have the effect inside the body. So you can have like sleds or LEDs and they can have an effect, but it's very superficial because it doesn't have the ability to get into the body.
So it's like a super aligned one wavelength that is really, really sharp in a way. Like the difference between a very sharp blade and a dull knife, right? Or basically a hammer, right? So you have a hammer, then you have a knife that is light, that is dull, and then there is something that is very, very sharp and very, very focused.
Yeah, like think of like a nail, right? A nail sharp and it comes down, so you're going to have more penetration. Whereas if you took a block, you might use the same amount of force, but you're not going to get the penetration.
So we know that laser has been used in veterinary therapy. And what do you believe catalyzed the shift in veterinary medicine to embrace laser therapy? Suddenly, 95% veterinary practices use lasers. And if you look back, like there weren't many practices. When I started practicing, there were not many practices that would be using laser.
So I started teaching about laser in 2002 maybe. And I would go to the room and say, how many people have lasers or you have used a laser, know anything about it? And maybe 5% of the people would raise their hand. Mm-hmm. Now I go into a room and I say, how many people of you guys have lasers? And at least 95% of the people raise their hand. Mm-hmm. There's so much research on it. And I wish that human doctors would use it as much as the veterinarians do, because it has so many effects. Yet, because insurance doesn't cover it for humans, the general practitioners don't usually use it. Your people who are out of pocket. So like I get my teeth cleaned. My dentist uses it before I leave, right? He uses a blue light and it decreases inflammation and kills bacteria. Podiatrists, chiropractors, naturopaths, a lot of those people will use laser because they can and they know the effects. And the veterinarians, there's tons of research that shows what it's good for, including, post back pain, or post surgery back pain, or decreasing the need for drugs.
Pain control drugs, painkillers.
Right. Yes. Painkillers, NSAIDs, right? So your Rimadyl and all of your Medicam, all of that can be decreased or gotten rid of when you're using a laser. But you have to use it appropriately and you have to use it as needed.
This wouldn't be the first time where we see the dogs and other pets and animals teaching us about therapies and giving us an example how it could be used in human medicine. So I'm not really surprised. It's a shame that it's not used in human medicine, but we also know that the education in most veterinary colleges and human medicine colleges is on some level lacking, because there's such a hockey curve of knowledge that has taken place in the last decade or two, that when you look at colleges and universities, it's natural that the senior professors may not be actually that keen learning new things. And I think that the learning is delayed. And with respect to all the people that are teaching and doing an amazing job, but I find it always really fascinating how long it takes for a certain technology or certain method to actually permeate into the materials that are taught in universities. So it's really interesting. I'm sure that people will be probably asking their doctors, why can't I use laser therapies? But could you share some cases where laser therapy effects were beyond your expectations, that just blew your mind because you just saw something that you didn't expect?
Absolutely. Absolutely. I have seen, oh my gosh, there's so many things like wounds, right? I've had a dog come in who had gotten into the river, banged up by the rocks, and literally the elbow was open down to the tendons, and had seen other doctors and they had put stuff on it and we're cleaning it, and they talked about debriding it or taking the dead tissue around it and closing it, but there wasn't enough tissue because it was on the elbow to close it all the way. And the laser did amazing. It healed it, I'd say at least 3 or 4 times faster than everything else they were doing. The client was shocked. The referring vet was shocked. I was happily surprised that we could do it. The owners actually were coming in every other day so that we could laser it. So it wasn't just like a once a week kind of thing, but that was wonderful.
what is the effect of the laser treatment on the tissue? Like what happens with the cells in the tissue?
So I'm so glad you asked that. I get to nerd out again. Okay. So with specific variables, right? So when you have a lower dose, but you're getting into the tissue, if you remember from vet school, you've got your cell and you've got your mitochondria, and inside the mitochondria where it makes the most ATP, right? Which is like the gasoline, the energy for the cell.
Energy source for the cell.
Right. It's the energy source. So at specific doses, it increases cell respiration. So you get way, way, way more ATP. So whatever that cell needs to do, it can do it faster and better, which is great for healing. Mm-hmm. And then at high doses, you actually shut it down. And there's like little to no ATP produced. And you'd be like, why would you want that? When you have a lot of pain, you want a higher dose. And it actually shuts down those nerve cells from sending messages up to the brain saying there's pain.
Amazing. So
it's actually like a nerve block. So you put enough energy in that it shuts that down. So it's blocking the transmission going up to the brain of pain so that the dog's like, oh my God, I feel so much better, right? And then the body starts kicking in and it can start to heal.
So it's virtually a two-edged sword, right? Like on one hand, it's going to promote the healing response and gives the cells in the body and tissues the energy to recover. And at the same time, if you go with higher intensity, I guess, it'll shut down the pain response and the nerves that otherwise would transmit the pain and the discomfort.
And it increases the diameter of blood vessels. Right. So you have more blood flow because you need the oxygen and everything that the blood can bring in.
Absolutely.
It decreases inflammation. Right. So if you've got like COX-2, right. So we talk about with our anti-inflammatories, our COX-1, our COX-2 inhibitors, interleukin-1, interleukin-6. There's tons of research that shows that it stops those chemicals from being released from the cells so that you don't get that inflammatory response that in itself can cause more pain. It works on some of like the TRPV1 mechanoreceptors. So things that like cannabis works on, it works on those receptors. It can speed up DNA replication so that you can have cells that you want to divide, like in the gut or in the bladder or cartilage. We can make those divide faster so the cells that, these are diseased, but we've got new ones coming in so we can feel better.
As you're talking, I'm kind of thinking, have you ever used it for, let's say, lipomas? Have you used it for any other lumps or tumors? Like what would happen if there was, let's say, a lipoma? Can it be addressed? Or what would happen if there was a tumor that you didn't know about? Would it possibly increase the growth, or do we need to be careful about this?
Absolutely. That's one of the contraindications. Now, there is some research that shows with some tumors, again, specific variables, you may have increased blood flow to it, but then you have the macrophages, the T cells that kill the tumor significantly increase around it, but that's very tumor dependent. So in general, you stay away from cancer, you stay away from the eyes, right? Because laser can actually damage the back of the eyes. You stay away from injection sites, right? Because if you put something into the tissue and then your laser may or may not heat the tissue, or it can increase blood flow to the area so that it may change how that medication is distributed in the body, or it may even change the medication. So we don't ever want a laser over an area that was just injected into. And then tattoos.
There was a study on pigs and heart attack recovery through laser therapy, which to me is groundbreaking. It's amazing. Can you tell us more about that?
Everybody needs to know this. Having a mom who had a heart attack, I wish I knew about this when she was still with me. So they did first one study where they took pigs and they cut open all the bones and they said, where are the most stem cells? And they found the tibia. Okay, so I have my little bones here, right? So let's go for a second. So here's a pelvis, here's the hip, here's the knee. So they found that the top part of the tibia, right, here's my little kneecap, had the most stem cells, and the ilium up in here had the most stem cells. So then the second study, they took pigs and they caused a heart attack, and half of them they just left alone, and half of them they lasered, not every day, just on day 2 and day 7. And then they didn't laser the heart, they lasered just the ilium and the top of the tibia.
Oh my goodness.
And on day 10, they took blood from all the pigs. And they found out that the pigs that had the laser on day 2 and day 7, way, 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 way more stem cells circulating through the body
oh my goodness.
than the pigs that
goodness.
didn't have the laser. And then on day 90, they euthanized the pigs and they looked at the damage to the heart. The average difference in size, there was 68% less damage in the pigs that had been lasered. Not even the heart, the tibia and the ilium on day 2 and day 7. Right? So why aren't we doing this for people that have heart attacks? It's crazy.
That is amazing. So is there any cutoff when, let's say older dogs don't have the stem cells there, or how can you produce the stem cell creation in those areas? Do they have them always in those areas?
Think about, where do we take bone marrow from? That's where we take it, right? From the ilium, because when we're doing a bone marrow transplant, because they have so many stem cells there. So all of my patients that have any kind of degeneration or any kind of injury, we laser the injury or the degenerative areas.
Amazing.
And then also the tibias and the iliums.
You know what is really interesting? That, many of our listeners and viewers know that my dog Pax had the kind of what some people call the neuter syndrome, where the luteinizing hormone rises and it causes inflammatory changes in all these different areas. And right after I neutered him, he started being lame here and there. He started getting injured in activities that he shouldn't be getting injured with. We now know that hormone-sparing sterilization is the way to go, but, I can't really go back with him. So we're doing some treatments, and people can definitely read about it on my website or on other websites. But what I'm really intrigued by, that when his first kind of like severe injury happened after he was neutered, there was almost like a little thickening of tissue or little, I thought it was scar tissue, but just at the area of the ilium. This is so interesting. And I love to connect the dots and pieces in medicine, because it really is like a jigsaw puzzle that you start putting together. And the more we look for the different pieces, the more we discover what the whole picture is like. And it's just fascinating.
Yes.
So before we get into the nitty-gritty of laser therapy, because, I know that that's what people want to know, I want to talk a little bit about safety, because I know that many people will want to get lasers and so on. I know that laser therapy does require stringent safety measures. Tell us about what people need to know, what we need to know.
Well, the first thing is that most of the time, if somebody has laser therapy at their vet, a lot of veterinarians are using class 4 lasers. Class 4 lasers is the classification is how much eye damage it can create. So if you're using a class 4 laser, OSHA requires anybody within X number of feet, and it depends upon the power of the laser, how many feet that is, to have special glasses on. So not just sunglasses, they have to be special lenses specific to that wavelength and that power. And then to me, the dog's eyes either need to have glasses on to protect them, or to have a thick towel over their eyes. So we do like the babushka thing, right? If the dog can't handle the glasses.
Like, how thick does it need to be?
So that the laser can't penetrate it.
Okay.
Right?
Okay. So there's no light. So airplane mask would probably be fine, right?
The thick ones for sure. The thin ones you would want to just make sure.
Yeah. Okay.
And then if you're doing it at home,
I mean, like the eye mask, not the other mask that we used to wear.
I know what you meant.
I'm not talking about that. Don't scare me. So glasses that are specially tuned to the particular frequency, and that's laser 4. And at home for the home treatments, and we are going to learn about it and talk about it. That's laser 3.
Class 3B, right?
Class 3.
Usually.
Okay.
And that OSHA recommends, but doesn't require. So that's up to the people. I mean, to me, safety is so very important. Anytime I laser anything, whether it be with a class 3 or a class 4 laser, anybody within, 7 to 10 feet or at the pets, right? Because if you're lasering like a shoulder or you're lasering the ear or the mouth or the nose, the eyes are so close. You want to be careful. We want to make sure the eyes are covered.
How do you spell OSHA for people?
OSHA. Okay. The other thing is if the dog has a dark coat or a dark skin, you may need to go over the area multiple times, right? Either moving it. The class 4 lasers, you have to keep moving. The class 3B lasers, you'll move back and forth over the tissue so that you can make sure you get all of the energy in. There's melanin in hair, right? Dark hair or dark skin. And that can absorb the energy so it can heat it. Say like in 810 or 835, you have to move it. If you have a 904 or 905, you can do all of the energy because that's not absorbed by the melanin. You can go right through the tissue and do all of the lasering in one place before you have to move it.
So it's really important for people to know what they're doing, because I know that some people can get laser tool, laser light beam or tool on Amazon or the internet, and then they start using it and they don't know what they're doing. They can cause a lot of damage. So that brings me to at-home laser therapy, which is how you coined your course and your methods and your instructions. In my eyes, it's a significant leap in really empowering people, pet owners, dog lovers, cat lovers, animal lovers. What inspired you to this initiative, and how has it reshaped the overall veterinary medicine and pet care, you think?
I have creme de la creme. I'm sure like you, my clients are amazing. They're super smart. They care about their dog. It's not the dog. It is my child that happens to have fur and 4 legs. And I found out that at the time, 50% of my clients had lasers. Now about 70% of my clients own their own lasers. And none of them, 0 of them knew how to use it appropriately. So I'm like, okay, if my job is to empower them to treat their pets so that I don't have to see them as much, it's perfect for me to create a course, because I love to teach how they can do it so they can see me less often. So if I want their dog, if absolute best for their dog is to be lasered, like you said, with packs, right? To increase the stem cells, and we want to do that twice a week. Getting into the vet is so hard, right? Twice a week is very difficult and very expensive. So if I can teach them to do that, and then they can have their own laser at home and do that, then I can see them once a month, once every other month, and just make changes as needed. And they can do most of it at home.
What is the course link? Please tell us.
Well, if you can go to OptimumPetVitality.com and you go to courses, at home laser therapy for pet parents. So I have a course. Wonderful. I've been teaching on lasers for 20 something years, but I'd mostly been teaching the professionals. So now this is a way, and it goes through the glossary. It goes through some of the anatomy gently, easily, so that people understand the difference between, I can show you on this, the difference between saying, okay, we're going to laser a knee and I'm just going to go over the knee, versus if you say, look, here's where the patella is, and I can push the patella over and laser right in there so I can get to the cartilage. If I have the knee straight, to get to the cartilage, I have to go through bone. But if I bend the knee, now I can get in and get that cartilage. And then I go to the back and straighten it out, and I can get the rest of the cartilage back here. And understanding that, where's my little laser? That if I take my laser and I know,
don't point it at me.
Even though this is round, it's not connected.
I don't have protective glasses.
The beam actually comes as a straight line through here. So even though this is round, the most energy comes right through there. So then, I mean, you can laser the knee any way you want, but because I'm anal retentive, I can say I want to get the medial lateral collateral ligament and then turn it sideways and actually get right in and get the meniscus. Right? So if my dog, if I'm worried about a meniscal tear, I can get in, right? All sides, front, back, left, right, and get all of it exactly on the meniscus. I can say, you know what? My cruciate sits right here. I can come in and laser that cruciate and then turn it this way to get the meniscus.
Fantastic.
I can get this cartilage, right? Because I know how my laser works. and I know the anatomy enough.
People will be asking about cruciates now, and they'll be asking about hips, and we'll have to do more and more recordings.
Can I show you real quick on the hip?
Oh, absolutely. Please.
I'll show you even with a bigger one, right? So this has 4 diodes.
This looks like a shower hose.
Yeah. Yeah. Most people, when they laser the hip, let me turn it so it's right side up, right? So head's going that way, tail's going that way. Here's the hip, but it's in the socket. So if you're lasering this way and just going straight in, you have to go through, see if I can do this, all of this bone to get into the cartilage.
Yeah, absolutely.
Right? You're not going to get a great effect. But if you instead, let me put him back together, come in at an angle from the front, from the top, from the back, then you are going right into that joint capsule, right? You're getting that cartilage, right? We even go from underneath so that we can get in here. Makes a huge difference. The dogs do so much better.
And that's why some people say that laser beam therapy doesn't work, because they just don't use it right. And that's the issue. The market is flooded with many different laser devices. And we know that they're not all the same.
Right.
How do you navigate the market, and how do you select the right effective laser device?
The 2 laser companies, and I will be 100% transparent, they're my sponsors. And they're my sponsors because I handpicked them. So the 2 devices that I highly recommend are the SpectraVet Zeus and the Respond 2400 VS. They're not super cheap yet. They pay for themselves in the first, depending upon which one you get and which probes you get, 60 to 75 uses. And you say, oh my God, that's so many. But in reality, if you're treating scars, right? You may have a cat that has kidney problems. That cat could be treated twice a week. Liver issues, ears, dental issues. I've watched ears go from red and horrible to pink, or red gums that are painful, stomatitis, and the mouths within 1 or 2 treatments are pink and the cats are feeling better. And then you spread out the treatments. Kidneys, anal glands, right? How many people have to go to the groomer or the vet to get their dog's anal glands expressed? Lasering first either makes it really easy to express, or you don't have to express them at all, because you're getting rid of all of that inflammation and allowing it. Or blocked cats, being able to laser the ureter, or the cats that have cystitis and being able to laser their bladder. Besides arthritis, there's so many different things that we can do, and people can do at home that can help their pets.
It's amazing how a little bit of light at the butt area makes a difference, right?
Yes.
I've been really interested in the area of the spay and neuter syndrome and the elevation of the luteinizing hormone, and that causing inflammation. And it makes me wonder, has there been any research done in the area of how laser influences the receptors that obviously multiply when dogs are neutered and spayed? Has there been any research, or is it still something that needs to be done? Do you know?
It still needs to be done. Yeah,
okay. Because it would be really interesting to see. Yeah. I have to connect you with maybe you already know Dr. Michelle Katzler and Dr. Linda Brandt, but they're amazing pioneers in that area. And it would be so interesting to actually see how the laser affects the LH and the receptors for LH that cause inflammation, because it would be really interesting to know whether something happens on that level as well, because it's possible, but we don't know. So those who are excited about the potential of laser, they can take the course and buy a laser and basically start helping their dogs with knowledge applied to their dogs. You said that many veterinary practices now use laser therapy, so that's amazing as well. Has there been any evolution of the laser technology in the past 10, 20 years?
Huge.
Effectiveness, precision?
Yes, precision, definitely. Where you're pointing it. They show, the laser you get directly under the beam, you have the most. Now you have the laser light bounces around in the tissue. You have effect beyond where your probe is, but you have the most directly underneath, right? So that's important. And then, so like this probe has diodes that stick out, right? So that it's coming out. So having this for animals is great because it can go through the fur, right? You can wiggle it around. Having an external probe, like this one is convex, right? So if you look at it, you've got that little, right, also is able to get in there. Some probes are flat and that pushes the hair down. So it just depends upon, what you like. I will tell you, because you asked about the course, we have 2 courses, one specifically for Respond and one specifically for SpectraVet. And we recommend for people that have a laser, if they already have a laser, right? We're not saying you have to buy a laser if you already have one, that has probes or diodes that are convex, right? That come out to get the SpectraVet course, and ones that are flat to get the Respond course. The other thing I'll tell you is if someone wants to buy a laser, if they buy the course first, they get 10% off the laser.
Okay, wonderful.
Which is a huge savings.
Absolutely. And, I know that it's impossible to talk about all the details here. So people just have to take the course, and either they spend money on veterinary bills and vet care, which is still important, of course. Like, we don't want to deny that.
Right. Of course.
But it can definitely be greatly reduced. What else is there to invest in? Large screen TV or dog's health? Like, come on. Like, it's just like, without a doubt, Laurie.
You want a really good laugh? You talk about like how we love to teach. I bought a 65-inch large screen TV, and I don't watch TV, like, ever. I bought it so that my computer can play it behind me, and I can create videos to teach people things and be able to point to things behind me.
Oh, nice.
Yep.
No, so you're also techie then.
I'm makeup techie, right? I don't know what I'm doing, but I figure it out. So we have Learn and Go's. So on the website, if you go to Learn and Go up on top, there's almost 100 free videos people can watch.
Oh, amazing.
And learn all, and you'll see the screen.
So instead of watching The Crown, you're teaching people on your big screen TV.
Yes.
I feel like another story or two from your caseload, from your patients.
Oh, yeah. Let's see. Opie's amazing. Opie's mom bought a laser. Opie came to me literally 3-legged lame and couldn't put weight on the front. He hurt his shoulder. And I lasered him. She got the laser. She worked on him. And I swear the opposite leg, 6-8 weeks later, he blew his cruciate. That's a $5,000 to $7,000 surgery. So they went ahead and they did the surgery. But then instead of me having to laser him like daily for 3 days and then every other day for a couple of weeks and then twice a week for weeks, they got the laser and they were able to laser it at home. And I just saw him once a month to change, like, okay, in the beginning, you're going to be icing and doing range of motion. Here's what you do. And then it was like, okay, here's the exercises you can do. And then here's the exercises you can do. And here's the progression. And then, wow, look how great he's doing. And it was awesome because a friend of hers, their dog had torn his cruciate similar time. So she was able, and they didn't do any rehab, didn't do any laser. So she was able to watch her dog and how fast he progressed. And this other dog, who actually had the surgery earlier, so should have been further ahead, and how slowly he progressed. So it was really eye-opening for her to be able to make that comparison on how much better the laser and the doing the exercises and the icing and the range of motion and all of that was able to help Opie.
That's really cool. Well, one of my friend's dog name is Opie. When I examine dogs and my dog, sometimes when I go along the spine, you kind of feel that some of the segments are less mobile and they're a little inflamed, or there's kind of like a little bit of nodding. Can you use laser in those areas? Because dogs often intuitively, they just love to have that massage or acupressure or even IMS, intramuscular needle stimulation, or anything like that really works. Like, can you when you feel that there is a spot that is really congested or the energy is blocked there, like, can you actually use it locally? And is there any potential for us to overdo it?
Great questions. So, hold on, let me see. I don't have a spine with me. I brought my box of bones, but I didn't
Just
bring the
let's
spine
pretend
with me.
that
It's in
your
the other
arm is a
room.
spine.
Okay. So let's do it this way, right? Because you have the dorsal spinous
Okay.
processes that stick up.
Yeah.
So if you have your laser and you go straight down, you're going to
Mm,
get some. But if you have like pressure on the nerves, you actually need to come in at an angle to get those
mm,
nerves, right? So that
mm.
makes sense. So can you get trigger points? Can I tell you a secret?
Yes.
70% of my clients have lasers. 100% of them use it on themselves. And so they will say, "Oh my God, Laurie, this is great. I treated my dog's shoulder
Yeah.
and then I treated
Yeah.
my back and my back is better." So I know from not only treating myself, because I do, right? Because every veterinarian does everything we can to help ourselves, um, that treating the dog's back is huge for decreasing pain
Of
because
course.
there's people that do it that can speak to you and tell you that it's all better.
Yes.
So we can decrease the trigger points in the back. We can increase the nerves healing. We can decrease the
Hmm.
pain. There's so much we can do with that.
Putting it all together in the bundle and doing laser therapy, doing rehabilitation, doing nutritional therapy, doing, looking into the hormonal balance of the body, and all that just comes together so beautifully. So, while we look far into the future and the uncharted territories of laser therapy and medicine, what excites you the most? What are you excited about?
I foresee that most homes will have a laser and be able to treat so much on their dogs so they don't have to go to the vet as often. The vet should always diagnose it, right?
Mm-hmm.
Hey, you have a hot spot.
Mm-hmm.
Okay, I'm going to go home and laser it. Or the laser, they'll use the big laser then, and then the
Mm-hmm.
pet parent can go home and take care of it. Your dog has anal gland issues. Your dog
Mm-hmm.
has your cat has stomatitis.
Mm-hmm.
Your cat has kidney disease. Your dog's liver is not functioning as well,
Mm-hmm.
or their pancreas is inflamed. We can treat that, and you can do a lot of that at home, as well as the arthritis and if you have a cruciate injury, or the knee hurts. Let's fix it before it becomes that cruciate injury,
Mm-hmm.
right? Because we can increase the stem cells. We can work on the tissue around it. We can do the strengthening exercises, right? So we always want to get rid of pain and then strengthen everything around it to prevent injury or heal injury.
Mm-hmm.
There's so much we can do.
With innovation, we always see the skeptics coming out of the dark corners of the and saying, "Oh, this doesn't make sense, and this is just a moneymaker, and laser therapy doesn't work." How do you deal with that?
Research, right? As much as I am intuitive about things, I depend on research. One of my favorite books came out in 2014, so a full 10 years ago, and had over 2,600 scientific research articles backing it up. I love and it's good, solid research. So are there
Mm,
studies where it shows that laser doesn't work? Absolutely. They have the wrong variables. If you put
mm,
too much
mm,
in, if you don't put enough in,
mm,
if you put the wrong
mm.
wavelength in, you're not going to get the effects. But when you do it right, it's amazing.
It's like, some people would say that metal airplanes can't fly because they don't design them right, right? Or they don't use them right. They don't know how to fly them. So it's just exactly that.
Mm-hmm.
And I really hope that we'll be able to talk more and empower dog lovers through knowledge. I hope that they'll be taking the at-home laser therapy course as well on your site. I'm not sure whether you knew, but this is so interesting because for 5 years I've been obsessing, or I've been asked for formulating nutritional support for joints and inflammation and so on. And this has been one of the most difficult products for me because I felt like I'm not going to formulate and bring it to the market if it's the same old and if it's glucosamine, chondroitin, and pernamuscle and a few other ingredients. And I really needed to feel like this will be much more comprehensive and based on solid knowledge and research and science. So we're just about to actually launch joint and mobility formula. And I'm just so excited that beside that, we will have some other tools because people can't expect one thing to solve everything, and that it is the synergy, and it is the synergy on the method and product level, but also the collaboration on the veterinary level. And every time I speak to you, I feel so hopeful because, the general perception is that there is not enough progress, that there is not enough change in medicine. But I think people like you make me really hopeful and make me feel like it's good. We're changing and we are moving ahead. And this is so fantastic.
Mhm.
So is there any final remark?
Yes. I have a gift for your people, for your followers. So if they want to text 866-949-0068 and put in the code word laser 101, I created an ebook, and literally I finished with the last pictures and last writing of it last night so that I could have it for your people. It's called Everything You Ever Wanted to Know About Canine Laser Therapy.
Amazing.
So if you can put it in your write-up,
absolutely,
right? Again, phone number 866-949-0068 and laser 101. Like you're going to college and you're taking that first level class. It's like a 23, 24 page ebook, which just gives people really good information.
You're so generous, and I really appreciate it. For everyone who's listening and watching, this is a North American code, so it's +1 866 and
866-949-0068. Yep.
I know that we'll be talking very soon about hips and cruciate ligaments and maybe back pain and many other things. I am so grateful that we got together. And, it's funny. Every time we get together, it just feels like you are a real energy refueling tank for me, at least. Like, I feel like, my goodness, this is so much fun. And I hope that we'll also be able to meet in the future in person, because that's when it's even more meaningful. Thank you so much for being here.
Oh, you're welcome. Thank you for having me.
Take care. Bye-bye.
Bye-bye.